A health commissioner discovers lead poisoning in his city's schools. He calls the CDC for help. Suddenly, the federal experts are fired. What he did next became a national moment for public health. This health commissioner joins us to share his public health journey and valuable lessons he's learned about leading through crisis. You're listening to the PHEC podcast, episode 431. Welcome to the Public Health Epidemiology Conversations podcast, where we have honest conversations with public health professionals who are creating meaningful impact in communities around the world. They know that the field of public health touches everything. I'm your host, Dr. Charlotte Hughes Huntley, and today we're exploring the fascinating journey of our guest and diving into another conversation that bridges different perspectives with the practical wisdom you need to fuel your impact. Greetings, everyone, and thank you for joining me on this episode. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports large nonprofit organizations and community health foundations. We specialize in a variety of community assessments, workshops, and trainings, ultimately helping our clients communicate their health information in plain language to their community partners as well as the broader communities they serve. This type of support often falls in categories of strategic planning and sometimes capacity building, just depends upon the needs of the organization. Please reach out to us through our website, drchuntley.com. We'd be happy to meet with you and explore how we might be able to support your organization. The links will be provided in the show notes. I'm very excited to introduce you all to my guest on this episode. When lead poisoning cases began appearing in Milwaukee's public schools, Health Commissioner Mike Totoraitis faced a crisis that would put his entire career journey to the test. From his unexpected journey into epidemiology through violence prevention work to leading a 240-person health department, Mike has built his approach around collaboration, clear communication, and the power of relationships. But in April of 2025, when the CDC team supporting Milwaukee's lead response was suddenly let go, Mike found himself navigating one of the largest potential lead exposure events in recent history without federal backup. In our conversation, Mike shares how he got here, what it takes to lead through crisis, and why building community trust and speaking truth to power matter more than ever in public health. Let me formally introduce him to you, and then I'll connect our conversation. Milwaukee Mayor Cavalier Johnson appointed Dr. Micheal Totoraitis as the city's Commissioner of Health in May of 2023, and then reappointed him in 2024 to a 4-year term. As Commissioner of Health, Commissioner Totoraitis oversees Wisconsin's largest health department, which includes approximately 240 full-time staff and an annual budget of nearly $40 million, and serves as the City of Milwaukee's health officer. He leads the department in alignment with federal, state, and local public health mandates while setting strategic priorities that strengthen core public health services, improve health outcomes, and advances health equity across the city. Some of the commissioner's priorities include achieving national public health accreditation, completing the department's strategic plan, modernizing data and performance systems, and steering the department toward a public health 3.0 model that emphasizes cross-sector partnerships, community engagement, and addressing social determinants of health. Commissioner Totoraitis joined the City of Milwaukee Health Department in 2021 as Director of Health Data and Evaluation, leading epidemiologists and analysts through the COVID-19 pandemic. Earlier in his career, he served as a program supervisor at Safe and Sound, managing community organizing initiatives, and previously worked in the health department's former Office of Violence Prevention as a violence prevention research coordinator. He co-authored a national manual on establishing public health violent incident review teams, reflecting his career-long focus on the intersection of public health, community engagement, and violence prevention. The commissioner earned his PhD in public and community health from the Medical College of Wisconsin, where he studied childhood maltreatment and resilience and holds a bachelor's degree in criminology and law studies from Marquette University. He is an active member of the Big Cities Health Coalition, the Wisconsin Public Health Association, and the Wisconsin Association of Local Health Departments and Boards, and the Milwaukee Rotary Club. He also holds an adjunct appointment with the University of Wisconsin, Milwaukee's College of Public Health. Let's connect my conversation with Commissioner Totoraitis right after we highlight our sponsor for this episode. Public health is about connection, and now you have a space built just for that. The PHEC Podcast Community app is where public health professionals come together to collaborate, share ideas, and support one another. Inside, you'll find exclusive events like Power Hour, which is our virtual co-working event. It helps you connect with others and boost your productivity. You'll also have direct access to conversations with other public health professionals from around the world, and even guests from previous podcast episodes. We're more than a podcast. We're a thriving community. Be a part of it. Download the PHEC Podcast Community app today and join us. Well, today my guest is joining us from Milwaukee. We have Mike Totoraitis. Mike, welcome to the podcast. How are you?
I'm great. Thank you for having me.
Yeah, this is fantastic. I'm really pumped up because we spent a good little bit chatting before hitting record, and I'm really excited about all the things that we get to dive into. Let's start out with you just introducing yourself. Tell everyone a little bit about who you are and what you do.
So my name is Mike Totoraitis, as you mentioned, and I am the City of Milwaukee Health Commissioner. So I oversee the health of roughly 600,000 folks here in our city and lead our department of about 240 staff. We have a $40 million operational budget and have a really wide range of programs that we offer. And both of those are mandated and strategic programs. So we have a really broad mandate and we're really excited about where our department's been heading coming out of the pandemic. And I've been a part of leading that change and innovation, moving into really a public health 3.0 model. So embracing community engagement and capacity building and realizing that we're not just the ones to do the work. So we have to do it as part of a broader ecosystem.
Love that. Love that. And there's so much we're going to dive into as relates to that, what you're doing there. I always love to kind of go backwards a little bit and learn about the journey. Yes, we're going to dive into what you're doing now, but I like to know how you got here. One of my favorite questions to ask is, at what point did you first learn about public health or consider it as a career?
I love this question because it is kind of a funny story. So my undergrad is in criminology and law studies, and criminology is based in the disciplines around sociology. So as many know in public health is stolen from every other field. And that's one of the reasons why I love it. But back in 2007, I had a field placement for my undergrad, and I was actually placed with an epidemiologist, and I didn't know that she was an epidemiologist until like 2 years into working with her. And her specialty is focused around violence prevention, and she helped start the National Violent Death Reporting System and did a lot of really foundational work within the violence prevention gun space. And her name's Mallory O'Brien. She's fabulous. She works at Johns Hopkins now. And I worked with her on the Homicide Review Commission here in Milwaukee. So we were doing violence prevention work, incident-based reviews, focusing on on-field shootings and homicides. And I was part of the data abstraction, doing a lot of data analysis and learning about what epidemiology was and learning about it without even knowing that that's what I was learning about. And that's really where I developed a passion for public health, because the parts that I really love are the collaborative work that we do and getting to work with subject matter experts of different spaces. And the piece that I really love is you don't have to be the subject matter expert on whatever topic you're is, but you do need to know how to bring those people to the table, communicate, identify shared goals. And throughout my career as an epidemiologist, I've really used a variety of different data, and being able to speak those language across different systems and partners has led me down the path to eventually being the health officer here in the city. So it's just an interesting moment to reflect on. I remember walking into the space at the police department's administration building in a suit, and Mallory was like, "Don't ever wear a suit again." And I was like, "Oh, okay, I guess you said that." But then, like, she's been my mentor since then. We've stayed in touch. Like, I watched her kids grow up. She watched my kids grow up, or I have kids now, and now they're growing up. But it's just kind of funny that this moment back in 2007 has culminated in us sharing a lot of academic work together, research work together, and just practical, pragmatic approaches to the needs of our city for many years now. I'm grateful to have had that direction for that long, because I know a lot of folks have had multiple mentors over time. And I think that's something that I'm reflective on and very appreciative of.
That's a really cool story. I love mentors. I've been a mentor and I've had great mentors. So definitely appreciate that. I'm just curious, when you found out that she's an epidemiologist, how did you feel?
I realized that I needed more training, and she's wickedly smart. And I always joke that she printed money because she knew how to write grants. Or still, I mean, she's to this day is really successful in extramural funding and bringing those different projects together. And over my career, after I worked with her for a couple of years, I ended up doing community organizing for several years here in the city, which was really great because it was like the other side of the work. You learn how to work with systems and institutions, but you also have to understand how to work with the people that make up the city or the jurisdiction wherever you're working. And I was able to see that through my community organizing work, and had the opportunity then to go back to school and get my PhD in public health. And those trainings that I had in my PhD training program at the Medical College of Wisconsin really were instrumental in helping me fill the gaps. And I didn't really know what to expect, so I don't have my master's. But getting that additional training really helped wire my brain differently, where I started to approach problems more systemically and ask better questions. And I think one of the biggest skills I learned, in addition to coding, biostatistics, and all the fun things, was how to absorb information very quickly. So it's often that I am briefed on a health issue here in the city that I have no experience with, but I have to listen to my subject experts to get briefed on it, to learn it very quickly. And having graduate level training really teaches your brain how to quickly discern what's credible information, figure out what the evidence base is, and then move through tough questions in a way that helps to identify potential solutions or partnerships. So I think that those are the things that I realized very quickly. I was like, wow, Mallory has all this. She has her master's and she has her PhD. And I was just like, man, I am out of my league in this space. But I also realized that she would make a great mentor because of that, because she had skills that I wanted to develop. And then she also encouraged me to do more hard data analysis and coding and things, because she's like, I stopped doing that and I don't remember how to do any of it. So she was like, don't ever stop doing that, because you need to have those skills. And that's how I structured a lot of my career development over the years, was making sure that I knew how to do the hard data analysis, because that was something that she was advising me to do, and it's paid off.
Yeah, that's great. Tell me about, how long have you been in this role? And tell me a little bit more about the current responsibilities as health commissioner.
Yeah, so I've been the commissioner for about 2.5 years. My predecessor actually became the secretary of health for the Department of Health Services for the state of Wisconsin. And she actually texted me when I was out on parental leave with my second child and was like, hey, sorry to do this to you, but I'm quitting. And I was sleep deprived with my 2-day-old kid. And I said to my wife, what if I put my name in for consideration? Because I was at the department as the director of health data and evaluation. So I led the epidemiologists and our data team. And both of us were sleep deprived. So my wife and I were like, oh, yeah, sure, put your name in. There's no chance you'll get selected. And sure enough, I got selected. So I've been serving in this role since then. So I got reappointed for a full 4-year term last year, I think it was. And essentially, I oversee everything for the department. I serve in the mayor's cabinet, so I help guide the health policy for the city and also help work with all of our health system partners or universities, anyone that's touching public health space. Like I really help to engage with them and make sure that they're connected to the city. And it's an incredible role. It's a lot of responsibility, but it's also really rewarding because I get to work with my staff on a regular basis on really cool projects. And I also get to do a lot of systems level work with our health systems or national partners. And I think that that's really an ideal space for me right now at this point in my career. I like that. The parts I don't like are getting late night calls about communicable disease issues or outbreaks. If there's public health emergencies, like weather events that displace a bunch of people, those can suck up your weekends. And I think in 2023, we had a measles case that ended up, I was working for like 13 days straight, right in our budget season. And there's a photo of me sleeping on one of our benches at our council hearing. So my staff took a photo of it. And that's like the running meme is me sleeping on my bench because I was just so exhausted from working 13 days straight. So that's the parts I don't like is having meme generating work. But I do really love seeing things come together and helping to improve the health of the city.
Oh, that sounds amazing. So what are some of the other, I guess, overlapping departments? We obviously know the health department would be under your umbrella, but you mentioned about 250 staff. So you touched on some of the different areas, but just to get an idea, because I know we often think about how broad public health is and how it overlaps so much, but can you just mention a few of those other departments or to give a context of industry overlap?
Yeah, so we have clinical services. So we do our STI treatment and screening clinic. That's our largest clinic in our department. So we have 3 clinics in addition to the work location that I'm in. So 4 work locations. We run a full public health reference laboratory that supports the lab reference network and a lot of the CDC's active surveillance. We do a lot of work within that. We do wastewater surveillance, which is really fun. And we're looking for different respiratory pathogens like flu, RSV, and COVID. We have a communicable disease team or immunization teams. We run immunization clinics 4 days a week across all of our work locations and a lot of mobile events at schools. We do food safety, weights and measures. So if you have a complaint about the volume of toothpaste in your toothpaste that you purchase at the store, you can call my department and we'll investigate it. And that is a true story. We had someone who thought their 2-pack of toothpaste was not actually the right volume of toothpaste. So we had to investigate. So that was a fun one.
Wow.
We do all sorts of environmental health regulation. So we've had some brown sites that have been redeveloped into like commercial and residential properties and have had issues with those like carcinogens being redetected. We have a lead prevention program, and that both focuses on lead abatement and case management for lead poisoned kids in our city. We do a lot of strategy work. We do a lot of coalition building through our community health improvement plans and our community health assessments. And we have an incredible epidemiology and data team. I would argue it's one of the best in the state. I'm extremely biased because I helped hire all those people before I became the commissioner. And I always love giving them a shout out because they're awesome folks. Really, you name it, we touch it. So we have mental health strategists, we have food strategists, any of the main kind of social determinants that we often talk about, we have some sort of footprint in that space.
Thank you for breaking that down. And you touched on a topic that is a great segue into something I'd love to talk more about. Milwaukee has definitely been top of mind for a lot of us public health folks regarding lead.
Mm-hmm.
And this whole was definitely crisis, but the timing very significant with all of the dismantling of public health that's been happening in this year with this Trump administration. At the time of this recording, just to put into context, in case someone's listening far ahead in the future there, but we're recording this late 2025, and this has been quite a year with, and it truly the gutting out of public health. So talk to us about that crisis. Maybe someone has not heard about that. So maybe start with what happened. And I'd love to hear about your role in that and as much as you can share with us in this conversation.
I would love to. Unfortunately, it's just one of those moments that you hope you're never going to be in as a health officer, regardless of the size of your jurisdiction. And just to kind of paint the landscape. So we're the population center for the state of Wisconsin. We also have the largest public school system in the state as well. So our school district serves about 62,000 kids in the city, and they have over 150 different buildings and schools that they operate for the children. And through our lead prevention program, we got a referral for a child about in their early 10s that had an elevated blood level. And when that happens, our team goes out and investigates and says, hey, where did this child potentially get poisoned? Depending on the level, we do remediation where we'll like go into a home and say, hey, they're likely have ingested paint chips, and we'll remove, lead paint hazards or make them safe in a home. Well, in this case, the home that we went into was built after 1980, so it didn't have any lead hazards in it. And the secondary address that we also investigated, like a family member's home, was built after the 1980s. So there's very low probability that this individual had been exposed at the homes. In further relationship building and just talking to the family, the child actually disclosed that they had been exposed at one of the schools. And unfortunately for HIP, I can't really talk about the specific route for exposure, but the child did disclose where the lead hazards were in the school. And our team, I remember the day vividly, we got a call back from one of our lead risk assessor managers who went to the school, and walking up to the school, he told us that he saw the lead hazards all over the school, just on the exterior alone. Went in, and sure enough, directly in the spot that the child had talked about, there was chipping lead paint. And it was quite severe. From the moment of getting to the school and then walking to that bathroom, he just saw lead hazards. It was everywhere across the school. So we were pretty nervous, and sure enough, made that connection with the lead poisoning, reached out to the school district leadership right away to say, hey, this is the problem here, what we're finding. And it kind of all snowballed from there. We identified a couple more children that had been poisoned at the schools, and every school that we went into had a pretty severe degree of lead deterioration. So we're talking about lead paint chipping on door frames, shelves, window frames, interior, exterior. It was pretty severe in the handful of schools we went into. So it was about 6 schools on the outset. So we realized we had a pretty significant issue on hand. And in Milwaukee, our lead hazards are regulated both at the state level and at the local level. So we had been working with our state colleagues and saying, hey, this is what's going on. But as we uncovered a couple more cases that were suspect cases, we were like, okay, we're going to need some federal help here on just understanding how to triage 150 buildings. Potentially, we're talking about maybe tens of thousands of children that have been exposed in these schools that were built before 1978. And I remember, pardon my not knowing the number, but I Googled how many children were poisoned at Flint, because I was like, what kind of comparison do I have here when I start talking to people? And it was around 20,000 children that had been actively exposed from that acute switching of the water. Now you can argue it's probably a lot more than that based on the timeline of what happened. But my initial Google search was like around 20K. And I was like, oh my God, that's, a decent proportion of the 60,000 plus kids at the district. So I was like, we have to talk to our colleagues at the CDC. So we reached out directly to them, started working with folks in the National Center for Environmental Health. They immediately were telling us to shut the schools down. We had detected really high levels of lead across the schools, and they said, shut the schools down. And we did. And the schools that we had been in that identified really abhorrent lead levels, we shut them down. And we were working towards what's called an EPI-aid, which is where they send Epidemiologic Intelligence Service officers or EIS officers to a jurisdiction to help with whatever's going on. So we have been planning for about 3 months. So this was in early January. We were starting to work with folks at the CDC. We were talking to them multiple times a week. And on April 1st, they were riffed and told that they lost their jobs. So I got an email. I was sitting at my conference table, and we were actually talking about our lead response. And I got an email from one of their epidemiologists at the CDC and their team from the childhood lead prevention team that they had all been let go and they would not be able to support us. So our EPI-aid request was transferred to another division within the CDC. And they said, they just said, we don't know what's going to happen if this is actually going to be honored or not. And it was like this really weird gut punch because they had gotten the RIF notification, I think, on April 1st, which is pretty ironic because it's April Fool's Day. But then a couple days later, then that matriculated to us that they had been let go. And we were like, well, this is really messed up. And I'm cleaning up my language because I was told not to swear on the podcast. But we were really distraught. And it's, again, this whole situation spiraled. We were asking for direct support and helping to screen these tens of thousands of children for lead poisoning and helping us do lead risk assessments across all of these schools. Because we were talking about 100 schools that we identified out of their 150 that need a priority review. And it just cascaded and it just kept getting worse. And then they all lost their jobs. We had no contact with anyone at the CDC. And they were all, from what we learned after the fact, was they were all trying to figure out what the hell was going on and didn't know who was still in place, who was not. And I was reaching out to my colleagues across the country and the other big cities saying, hey, who knows if, so-and-so is still there, who has contact information at anyone in the CDC. And that's basically when our story went national. So we were doing interviews with ABC and NBC and CNN, New York Times. Everybody wanted to know what was going on at the CDC and how they could abandon a local jurisdiction in a time of need. And it was a really crazy moment to be calling a Kennedy a liar on national TV. I never thought I'd have that moment in my career, but I knew it had to be done because of just how important that CDC subject matter expertise is in moments of crisis. And I spoke to it in many interviews that what a lot of average citizens don't understand is that the CDC offers a lifeline to people that don't have subject matter expertise in their local jurisdiction or into their whatever the health issue is in that locale that you're working in. It was just surreal. And even thinking about it now, I'm still kind of in awe of what happened.
How did you, of course, those CDC, that team was brought back, but what do you think was the turning point to you guys getting that win and getting that support brought back?
I think public advocacy is still extremely powerful. What we spoke to consistently was that these health issues affect everyone across the country. It's not a Democratic issue. It's not a Republican issue. It isn't. These health issues like lead poisoning in children is something that is universally experienced. Now, certainly in certain jurisdictions, it disproportionately hits different racial and ethnic groups. However, whether it's communicable disease to lead poisoning, there are issues that affect all of us, and not having the expertise in the CDC to support in these moments of crises, I think really was a galvanizing moment because around that time, Secretary Kennedy was starting to promote a lot of his changes to the ACIP and just how they were going to work through vaccines. And obviously then it morphed into Tylenol being a cause for autism, all the just unscientifically based assumptions. And it was alarming, I think, for a lot of people involved to see that the local jurisdiction was contradicting the federal government in very tangible ways with receipts. I felt that because we were talking about the truth and had the receipts, and others across the country were experiencing similar levels of confusion and dysregulation with how they're working with the federal government, that was a galvanizing moment where I felt that there was support across the aisles to have CDC and HHS held more accountable to what was going on. Now that has changed, right? There isn't the same crisis or public health issue that's in front of us. So it was a fleeting moment, arguably, but it did get the folks their jobs back at the National Center for Environmental Health, which I think was a huge win.
Yeah. What I'm hearing and what I'm taking away from this story is something that I've been really leaning into myself, and that is, this power of community, that community buy-in. I've been on this podcast, my immediate response was, how can I leverage my podcast platform and the people that listen? How we explain public health is complex. So at the very minimal, like being able to have these conversations with our friends and family about what public health is, like through the lens that we operate. Like as an epidemiologist, I can make sure that my family and friends understand public health through my lens. If someone else is specializing in environmental studies of some sort or policy or whatever it is, they can really getting their family and friends to understand the truth of what this really means instead of, because it's easy to push it off and not worry about it. But if we do that, then that immediate circle of friends understand, they're armed with truth, they're understanding, and they're repeating that back to their circle. We get that community buy-in. We share our stories. And then the people that care about us on that local level are going to start to collectively advocate to our policymakers, to our legislators. It's not just a handful of public health professionals shouting out, but a real community of folks that understand. And then the story you just shared, with that being a real turning point, I mean, that's where our power really lies, I think, is rallying with the community.
I would agree. And I'd add to that, we, at the onset of the whole lead crisis, we immediately released all of our lead results and our testing and all of the information that we had on a public website. And we leaned into making sure people had access to information. And that's a through line, I think, to this moment that with the politicization of public health and just a lot of the issues that we're experiencing across the country, to your point about community, one of the main successes of a strong community is access to information. And I might not be able to convince one of my family members that they should get the flu shot this fall, but I can provide access to information and a sounding board so that they feel heard and respected. And I think what I feel is a really important step to take right now in the public health space is, sure, I can judge somebody and say they're not making an evidence-based decision by skipping the flu shot or the COVID shot this fall or RSV or whatever respiratory illness you're talking about. But I think it's more impactful, especially with the polarization of our country, to provide access and provide a sounding board to somebody that has questions about things. And it's scary. It's difficult. I've had difficult conversations with friends and family that I don't necessarily share the views that they're taking and how they're interpreting evidence and science. And that's tough, but it's not unique. Like history keeps repeating itself. So we continue to vilify the other side and not listen to each other. And I think providing access to information and dialogue is a critical step that we need to do, both, I would argue, personally and professionally, to help move both public health and this country forward.
Yes, absolutely. Love that I'm making that access to information. And I chuckle because I have that family. You know, I've shared this on the podcast a few times. I mean, I don't have the luxury of everyone at my family dinner. We're not always sitting around the table with the same views and opinions.
Mm-hmm.
It's very, I mean, we're just always very different in polar different views. So having difficult conversations is just what I've always had to do. It's just the way my family dynamic is. And so bringing that into my professional circle gives me an advantage in the sense that I've got a whole lot of practice with this. And it's something that we have to, master that skill.
Yes.
There's no other way around it. The day of trying to just tell people what to do, those days are gone.
Mm-hmm. They
didn't really work for us well anyway. But it's really about conversations and access to information. And I won't even say chasing after this crisis of misinformation and disinformation, because that's extremely exhausting, won't win, but more of I had a guest that talked about pre-bunking. We can start dropping these elements of truth and let them feed on that. And it's actually working with some of the most challenging members of my family. I see some of that working.
Yeah, I do think the fostering connections and building relationships, while it's a good professional tactic, you know, I remember having a coffee with somebody many years ago, like 14 or 15 years ago now. And it was really, I was like, I think this person's going to do something. I just want to know them because I want to have this connection. And I love that kind of networking over coffee versus like going to a conference and cold introducing yourself to somebody. And sure enough, that relationship from that coffee helped get me back to the health department for a second time. And now here I am as the health commissioner. So it was just a simple cup of coffee and a conversation that built a relationship that transcended a lot of our professional paths. And I would argue that the same could be true for family and friends, that someone who rather than judging somebody for not getting the fall flu shot, if you're talking about it in a way that's respectful and understands that people have different opinions, that year they might not do it because they've already made up their mind that year. But maybe next year they see a different story or a headline or somebody talking about it. They're like, you know what, I'm going to go back to Mike and talk to him about this because he brought it up last year and he wasn't a jerk about it. So like, let me just ask the question. And I think it's those simple things and simple acts of, frankly, kindness that will help us translate public health into action.
Yeah, I agree. I am loving this conversation. Absolutely. This has really been a highlight for me, and I'm excited. I appreciate you taking time and sharing so openly with us wonderful stories and examples and your walk and things that you're able to accomplish. I think for the sake of time, I want to kind of wrap up, but I'm going to leave it a little open-ended. Is there anything that you would like to share that you'd hope to share that we haven't gotten to yet that we'd like to close out with?
Yes. I think one of the pieces that we talked about at the onset and before we were recording is just like how to communicate what's going on and trying to distill back the science and the epi speak and all the things that we do in our circles with epis. Because we're all trying to puff our feathers and to sound smarter than the other person. But I would argue with the public and our friends, it's much more challenging to distill it into something simple. And I have 2 young children at home, and they're often like, why are you on TV? Or what were you doing, with the mayor? And I'll often just say, I was trying to help people not be sick. And I know there's all sorts of different definitions of what health is, but I think being able to recognize your audience and then attenuating your language to something that can be a soundbite that people quickly get really is needed in this moment. We learned a lot in the pandemic where we were given sound bites every hour on the hour, it seemed like. And I think understanding that you can convey information really simply not only helps you get your point across, but it also builds trust that you're not trying to change the message or be gray in what you're saying. And I think it's okay to lean into some of your authority that you have as an expert, because I think we need to rebuild that in public health.
Oh, yeah. I 100% agree with you on that. That has come up a few times, those little soundbite. And it's part of that series. It's really why I'm leveraging the podcast and bringing the series of what is public health and having a little roundtable discussion. So we have this collection of stories and ideas and just hearing how people are easily explaining, and I say easily explaining through their lens. I think these explanations are really conversation starters because there's no real easy, all-encompassing definition, but it's a place to kind of start having conversations. And I think that's a great win. And that's a great way to proceed as well, because sometimes people aren't ready for it in one big, deep conversation. It's just little bits. So, thank you so much. I've enjoyed our conversation, learning about you, and appreciate all the work that you're doing as well. So thank you so much for being my guest on this episode.
Well, thank you for having this space. I think it's critical for public health and the public in general. So appreciate it.
I really hope you enjoyed that conversation as much as we did. Mike's journey shows us that public health isn't just about data and policy. It's about relationships built over coffee, conversations that create trust, and the courage to speak truth even when it's uncomfortable. Whether you're providing access to information for concerned families or standing up to federal leaders on national television, the work of protecting community health happens through connection and clarity. In a moment when public health faces unprecedented challenges, Mike's story reminds us that local leadership, community engagement, and unwavering commitment to evidence-based truth remains our most powerful tools for creating change. I encourage you to connect with the commissioner and learn more about the great work that he's doing in Milwaukee. You can find the links to connect with him on the show notes page. The show notes page for this episode, which is episode 431, can be found at phecpodcast.com. Once you're there, just navigate to episode 431 to find its show notes. One more thing before we go. Remember that our podcast has an app and private community where you can engage with public health professionals around the world. You can download the PHEC Podcast Community app in your mobile app store, and it's available for both Apple and Android users. You can also visit phecpodcastcommunity.com to join the community on desktop. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening. The show notes page is where you'll find links to everything we discussed in this episode. To find the show notes for all of our podcast episodes, just visit phecpodcast.com.